Hi, this is Dr. Doreste with the Cranial Release Technique, back with a new video. This time something a little different. I was sent a few questions by a group of chiropractors and I wanted to address that and these questions. And the first one is, how did I get involved in cranial work? So I graduated in December of 1985 from chiropractic school at New York Chiropractic College, and I practiced in Flushing, Queens, in New York City for a number of years. And around 2000, 2001, I realized that I was missing something. I was a very good osseous type adjuster. I know how to adjust the spine and the extremities. But I really felt that I was missing something. And I knew what I was looking for probably was not in the spine or the pelvis. And really the only other area that I really was starting to think about was the cranium, and I had not really had any cranial experience. It was around that time that I attended a lecture, and the lecture went something like, by the way, 80% of the nervous system is in the skull, which of course is the brain. So here I am as a chiropractor working on the spine, which is virtually 20% of the nervous system, understanding that my job as a chiropractor was to clear interference from the nervous system to allow the body to function better. And here I came home and I realized I'm missing the main player in the game, which is the cranium. And that's what led me to look at cranial work. The next question then is, how did I come up with the cranial release technique? Well, that then took me a little time. After studying different cranial techniques, in 2005, I launched the cranial release technique. And I launched it after I had experimented in my own practice and felt comfortable enough with me doing it on patients, seeing changes that I never saw before with traditional type chiropractic. And now I felt it was time to share the work with the profession. And to my dismay, many chiropractors, like myself earlier, were probably not that interested in cranial work. They had found it very time-consuming, very difficult to learn, very difficult to perform. And so I started to open it to other practitioners, and a lot of other alternative practitioners were very open to cranial work, were already using cranial work. So the cranial release technique really is open to any licensed practitioner that allows you to put your hands on a patient. So that's how that all came about. The next question, what's the underlying premise behind the cranial release technique? Well, the underlying premise is obviously we want to optimize function. And to optimize function, we have to optimize central nervous system function. The brain and spinal cord controls and coordinates all functions in the body according to Gray's Anatomy. The premise behind the cranial release technique is that all of the 22 cranial bones need to move. And if that movement is restricted from traumas, from stresses, be it physical, chemical, emotional stresses, and that cranium doesn't function properly or breathe properly, as the term is, the primary respiratory mechanism, if that cranium doesn't breathe properly, then the brain and central nervous system cannot function properly, and therefore you cannot function properly. It's a pretty simple concept, and the beauty is because the cranial release technique takes all of 1 minute to achieve, it's a very simple but very precise and accurate technique. It has to be done just right, and the beauty is that the opening of the cranium happens from inside out. It happens by way of the patient's own body. So me as the practitioner is just sort of setting the table and waiting for the patient's body to do the work from inside out. That's the beauty of the cranial release technique. And the next question, what does CRT have to do with optimizing function? Well, I think we just covered that. By optimizing cranial respiratory mechanism, or the primary respiratory mechanism as it's called, that will optimize central nervous system function and therefore your overall bodily functions, your bodily physiology has to improve because of that, regardless of where it is in the body, because the nervous system touches everything. The nervous system controls all functions in the body. What's one of the most amazing or unbelievable things that I've seen after applying the cranial release technique? Well, it doesn't really matter, what happens to the patient after we're done. I'm expecting them to function better. Now, some people do go through what we might call strange reactions. I've done some other videos on that. Probably one of the most amazing things that I've ever seen was a little girl that was brought to me from a young couple that came up from Mexico. They were living in the Bronx. The girl had a very traumatic birth process. She had a brain dysfunction diagnosed. They told the patient she would never walk, never talk, never go to school. She had a feeding tube. She couldn't swallow. And these patients brought that child to me. I guess at the time she was maybe a year and a half, almost 2 years old. Tiny little baby, like a little doll. Beautiful little baby, beautiful. As I was applying the cranial release technique, I was up at the baby's head. She was forcibly kicking me to kick my hands off of her head. It was the first time and last time that has ever happened to me, and I worked on a lot of children, a lot of babies over my career. The next morning, the parents reported to me that when they went in to look at her in a playpen, which she's always been on her back, she was standing up, holding onto the playpen, smiling at mommy and daddy, and they absolutely flipped out, as you might imagine. They came in, they stayed with me about 10 visits, and I think they moved on. I have no idea what happened to that little girl, but that was one of the most dramatic, and I have many stories like that, and I don't really like to talk too much about those types of stories. They do happen every now and then, but it's just as important to me for the person that comes in and says, gee, I've been suffering with headaches for X amount of years, and this cranial release helped me with the headache, or helped me with the skin trouble, or helped me with the digestion, or helped me with my reflexes, or help me hit a baseball better. Doesn't really matter. We're addressing the cranium, optimizing function. That's the point of what the cranial release technique is all about. And again, regardless of whether you have symptoms or not. So as I've mentioned in many of my videos, I get worked on with cranial release on a regular basis, minimum once a week, many times more. Not because I have any aches or pains or symptoms, but because I want to optimize function. So that's something to consider. It's a very different model than the typical model of you don't feel good, you go to a doctor, you get some sort of treatment or pill or remedy, and then you go on your merry way until another problem happens. This is more of a wellness, a preventative maintenance type program that we do in the cranial release technique. The final question is, what famous person or celebrity would I like to apply the cranial release technique to? Well, today's June 28, 2023. I guess if I had to think about that, the person right now that I would be very interested in applying the cranial release technique would be Robert Kennedy Jr. And the reason why, obviously we know, and he's come out and spoken about his issues with his voice. And I don't know that I've ever had anyone that I've ever worked on with that particular problem. But I have worked on many people with voice issues, hoarseness issues, issues in the throat, and seen fabulous changes with that. So I guess that would be my answer. I also think he's I think he's a man of integrity, and I would love the opportunity to work on him to help his body function better. Hopefully that would help him speak better, and to be a candidate of the president here in the United States in 2025. So if anybody has access to Mr. Kennedy and you want to forward this clip to him, that would be great. I would be delighted to see if I could help him with that. Okay, I think that's it for now. So again, The website is cranialrelease.com. And on the website, you can search for a practitioner in your area. If you are a practitioner and you'd like to learn more about how to learn the cranial release in the comfort of your home or office, you can click on that button. It's called the online training program. That'll give you all the information you need about that. And in addition to that, if you're watching this on YouTube, if you wouldn't mind subscribing, that would really help the algorithm to get this work out to more and more people. Okay, Dr. Doreste with the Cranial Release Technique. Interview's over. Adios, my friends. Be well. Hope to see you down the road. Be well. Adios.